I'm here with Valerie Millsap, so the Pregnancy Resource Center in Maryville, and I had the distinct pleasure of being able to visit you. It was such a great visit.
Yes, it was. I wish we had time to go to our Sevierville office. We just opened last year. And our mobile health clinic too. So
I love that. I love that. So Valerie, how long has this pregnancy center been open?
We've been in the community since 1986.
Wow.
So we're celebrating our 37th year, which is incredible.
And you've been with them how long?
9.5 years. So they say the average burnout for ministry leaders is 3 years. So I have been through 3 cycles of that.
You've defied the odds.
Yes.
I love that. I love that. You know, we were talking a little about who the client is today.
Yes.
What does that client look like today?
The client looks, it's more complex than what it used to be. We are starting to see maybe not just what they're in current situation right now, but what has caused them to come in our doors. There's a lot of, we always call it a lot of root and baggage that they've carried along with them, and really being able to unpack that, to see where they are as individuals, and really wanting to invest in them, to help them just bring them back to life again where they're healthy and whole. So we really try to focus on that wraparound, that holistic care for not just the moms but the dads as well.
I love that. You know, I was so encouraged when I saw your center because it's so medically driven and is medical.
Yes.
And you have a wonderful team, right?
Yes.
Tell me the services you're offering.
Oh, well, partnerships is a big thing, so we couldn't do it without our community. We have 5 registered nurses on staff, and so that's throughout our 3 locations. So with that, we're able to provide the basics up front, find out they're pregnant, so pregnancy testing, ultrasounds, STD testing. We have a great relationship with local pharmacies and health departments. So before 2020, women, we would help them get on TennCare for our state.
Yes.
And so that was trying to walk them through that process. So for them to do that would take months for them to be able to get into OB care.
Yes.
So that was so crucial. So we started trying to investigate, well, how could we help eliminate that? What could we do?
Sure.
And so we started looking into maybe offering that early prenatal care. But then through conversations and the relationships with those community partnerships, we were able to shorten and expedite that with the help of the health department. So now they come in, they're pregnant, we are able to fax their confirmation of pregnancy to the health department, and they get on with, they ask them questions about their income and things like that. But they can get on insurance within days, so they are in their OB care like within weeks.
I love that.
Which is amazing.
It is amazing.
We give them a voucher through a partnership through local pharmacies that they can have a 30-day voucher for prenatal vitamins, so they can already go get that script, get it filled. And then we're asking the hard questions. What is it? What's the barriers to your success for fatherhood or motherhood? What does that look like to you?
Right.
So being able to help them and kind of really just create a program for them, individualized, to really help them succeed. So we do that. So we have a lot of medical staff, but we also have 50 active volunteers. So that each carry their own gifts, their own personalities that come alongside. So they get their own, basically their own mentor. So we, to be able to walk alongside them.
I love that. You know why? Because the government doesn't do that for you, right?
Right.
It's only really through people who value and care about life.
Yes.
And care about the individual.
Yes.
That they're able to say, let me walk this journey with you.
Right.
Let's get you the best of the resources we can.
Definitely.
Right? I love that you have that relationship with the health department to be able to get someone in. Now, that's not the case everywhere in Tennessee.
No, it's not.
You're very fortunate.
Yes,
I'm
definitely.
super impressed by that. But now what I'm even more impressed is that you are going to be getting a medical mobile clinic.
Yes, yes.
Tell me about that.
Well, we've had one since 2017, and it's been an amazing gift, a tool for us. So we were really had this vision of we need to go outside the walls of our brick and mortar, because a lot of barrier. We don't have public transportation where we live, especially for rural areas. They definitely don't have transportation. So, and a lot of the families were coming from rural counties. So I was like, how can we get to them? So for you and I, it's like, oh, I'll just go across town, no big deal. But for somebody that is just below the poverty line, gas is a huge expense for them. I'm either going to feed my child or my family, or I'll have a way to get to work, or I can come to you all. It's just making those sacrifices, and many times they're come up short of what they need. So taking that mobile unit out when we got it in 2017, those rural areas was huge.
Oh,
it helped,
huge.
and then connecting them, because they don't know, they're in such a fog of how am I the only one going through this? Is there resources to help me? And we know that there are resources upon resources to really help them thrive, to be the parents that we know they're capable of being.
Yes.
So connecting them with that, provide that medical services that they need, that first step. And then it's like, well, can we come back and meet with you? Is there a resource in your community that's, because some of them are far from our main brick and mortar.
All right.
To get them plugged in, plugging them into the local church, that's huge. We have great partnerships with our local church to be able to, as we're walking alongside them. So, for example, last year we saw 1,782 families.
Oh my God.
And we hover around that 90-95% ratio for them to choose life. So that is just, that's amazing, and we applaud that. But that's just the first step.
Right. Right.
So being able for them to choose life, but it's really having an abundant life where they're thriving as parents. And we are a great parachurch ministry, basically, but being able to partner with other people that will help them along their journey and disciple them and continue to mentor them when they're ready to take that next step for them.
Am I to understand you're going to receive the 100th medical mobile?
That's what we've
clinic,
heard. We're
updated?
super excited. Our mobile nurse is thrilled, because you don't realize how an extra 10 inches makes such a difference. So our mobile unit right now, we've learned that the little things, like when you build a new house, it's like, oh, we should have done this, or we should have tweaked this. So this makes it super easy to really get what the mom needs that's coming on that mobile unit. And we're going to be able to enhance just the growth in that, and it'll be such a tool for us for many years to come.
You are an author. You are a speaker. I got to hear a bit of your testimony. I was so moved by it. Would you share a bit for our audience so that it really spoke to me about what drives you and what has gotten you up in the morning?
Yes, definitely. So I faced an unexpected pregnancy 24 years ago. And not knowing, believing the lies that I am the only one going through this, facing the pressures to have an abortion, not knowing that I had someone to talk to outside of my family. I turned away from the church. I was raised up in the church, and just graduated from high school and graduated from church as well, and just ran in that opposite direction. So here I was, pregnant, not knowing where to turn, but then coming back home but having support at home, which is helpful. But a lot of these families that we see don't have that. I chose life for her, and she is so we have 2 daughters now. My husband adopted her before we got married, and before she had his last name before we went to school. And just thinking and God using that brokenness, those tests and those trials to be a testimony, those messes for a message for him. and being able to look across from a woman and really tell her that she is not alone.
Right.
We're going to be there for her. We're going to walk alongside her until she knows that she has this.
Yes.
And that's what we're seeing, because, you mentioned that the government doesn't provide that.
No.
I was on formula help, so WIC, Women's, Infants, and Children program, and I would spend many hours away from my job to be able to sit in the WIC office to try to get formula to feed my daughter.
Right.
But I thought I could be working and being able to, provide for her, and aside from sitting in the office all day, just to be able to get a voucher to get some formula. So just being able to be at a woman, yes, you may need that for a season, but
Right.
you're so much more to than just sitting in that office. God wants something so much more for you.
Yes.
And so my daughter is 24.
Wow.
And to be able to look at her and see just the miracle that she is. She's married. She got married last year and has our first grandson.
Oh.
And it's like, it's not just looking at that woman that's in an unexpected pregnancy and thinking all the world is caving in on her,
Right.
but it's being able to look at her and see beyond that, to see beyond, see so much more for her that
Yes.
she can't believe in that moment.
Yes.
And help her get to that point. And it's moving past those barriers, those strongholds, those generational things that they've had to face,
Yes.
and helping them pull them out of that into the goodness that we know that's waiting on them. And they're hungry for that.
They are. And today, even for teenagers today, what would you say? Well, teens are coming through your door every day, so what are you telling teens today?
Yeah. So when they find out they're pregnant, we walk them through. We have so much of that wraparound holistic support programs
Yes.
to plug them into, whether they need a spiritual help or any of that. It's like, let us walk alongside you. You're not by yourself. So for women, they're getting plugged into mentorship and walking alongside. Maybe it's our Bible study through Embrace Grace. We do that, or it's just to individualize mentorship to help them, or even the fathers. And I've heard that, if fatherlessness was looked at as a disease, it would be an epidemic.
Absolute. You've hit it so on the head. In fact, when I visited you,
Yeah.
you were holding a men's meeting that evening.
Yes.
And just cars were coming in.
Yes.
It was so encouraging.
Yes.
But fatherlessness is at epidemic
It is.
portions, and it has a direct impact on family health.
Yes,
and well-being.
it does. It really does. And, there may be a father in the home, but he's not present in the home. Or there isn't a father in the home. And that's a lot of the families that we see. So we have volunteers. Of course, I mentioned that we have 50 active volunteers. So that's men and women. And to have a man come in and just be there, to be present, to show up, is huge. So we have male and female advocates in the room as their support alongside of our medical team. So to have a voice of an earthly father that they've never had, to say, I'm here for you, I'm going to help you, and I'm going to come alongside you, to a man and a woman, that is huge, because they've never had a father. They don't know what that looks like. But to have that voice and that motherly figure saying, I'm going to help you, they've never even had that. They've never had people speak life into them, or tell them that they could do it. And so we're doing both of that and pointing them to their Heavenly Father, which just seals the deal in my book.
This is what I love about you so much, though, is that as I left, I said, I am so encouraged, because bringing the reality of what your center, and I'm sure your second brick and mortar center does,
Yes.
is really that a restored hope,
Yeah.
a restored faith. We meet so many people today beaten down in life. I find what you're doing extraordinary. And I think it's why you've probably lasted 9.5 years by the grace of God.
Yes.
Because you're innovating all the time. Because our clients need that, don't they?
Yes, they do.
They really do. And
Yeah.
I think Tennessee can be very proud of the work that you're doing.
That's awesome.
I love visiting and seeing life-giving. And to me, you guys exemplify life-giving.
Yes.
So I'm just so excited that you're here. And I'm so excited, hopefully, that the 100th mobile medical clinic is going to be with you.
Yes.
It's going to be great.
We can't wait. I have emails just for us being here this weekend of like, I want to be there at your dedication.
Yes.
So I'm jotting those people down, and it's just excited to have community support and, we're there every day in the trenches doing the work.
Yes.
And we know that we have a community support that's coming alongside us, even though they aren't serving with us individually, because they give to make the work possible. It's just, they're saying with a loud voice, I will be here for you and I will help you. So it's like our banquet, our event that we had just last month.
You were planning it, actually, when I was there.
Our fundraiser, we had 600 people in the room, and there's more that couldn't come.
Of course.
But that one night, those are people that show up for that woman that we're sitting across from the next day to say, and not only will we help you and walk alongside you, there are thousands of people that are saying the same thing. That's why you didn't have to pay for a dime for services when you came in.
Yes.
You don't have to worry about that.
I want to thank you, though, for just being a leader in the state, a leader that people are learning from. It's refreshing to see someone step up. And you really, to me, you exemplify that.
Thank you.
So Storks wants to thank you. We thank you for being a friend and partner. And we're going to hear more from you. We're going to hear more from you in this next phase. It's going to be great.
Yes, I'm excited.